Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the current pandemic in the United States for the week of August 23rd, 2020. As you'll recall, even though the pandemic was recognized in late 2019, it really had a relatively slow growth early on. The same was true in the States, relatively few cases, and in fact, the first death was reported in early March. Then the number of deaths has grown. It's interesting that in early to mid-March was when we started making some important adjustments in terms of social distancing and shutting down. A lot of people were critical of that move at that time, but when you see what the epidemic actually did, you realize that it was really important to take those steps as early as we did. And the epidemic, this is deaths in the United States. I'm going to pause here for a moment, just ask you to remember this number, about 130,000 deaths by June 28th. Continues to grow such that now by August 23rd, we've had over 180,000 deaths in the United States, almost 6 million confirmed cases, and about a 4% increase in the past week and 20% increase in deaths in the past month. The reason I asked you to remember that 128 was that was about halfway through the year. And normally in any given year, about the first 6 months, we'd expect this many deaths from each of the 10 leading causes of death. And what you can see is that 128,000, 130,000 places COVID as number 3. So it is the third leading cause of death in the United States. If you look at cases in the U.S., they went up quickly, came down a little bit. This is daily cases, went back up and slowly came back down again. I'm not a big fan of following cases because it's dependent on how many tests you run. So I prefer to look at deaths as your daily deaths. Early on, there was a spike, and it slowed down, then it started to pick back up. Now it looks like it may be leveling off again. I talked before about the importance of looking at the pattern, and this is the pattern that we saw in Belgium. Belgium has been the most heavily impacted country in Europe, but their death rate, the number of deaths went up, and then it's been leveling off for a while. And it's not just Belgium, it's all of the countries in Europe that were heavily impacted. We see this as what we would call a mature pandemic. It's leveling off. But the U.S., we haven't quite seen that. We see it slowing down, but it's not leveling off. And the question is why? Why are we seeing this slowing down but not leveling? Well, the reason, the other way to look at it, by the way, is look at percent increase per week. In Belgium, it's dropped down to less than 1%. In the U.S., we seem to be leveling off somewhere between 4 and 5%. And why is that? Well, it's because you have to think just like the rest of the world, where the pandemic is hitting the U.S. in different times. New York, one of the most impacted states, you can see it levels off very much like we see in Europe. In Virginia, on the other hand, it's slowing down like the rest of the United States. Tennessee is still going up a little bit, and states like Florida are going up even faster. This is not to be critical of decisions being made in those states. This is much more an issue of the fact that the epidemic is arriving differently in different states. If you throw a pebble into the water and the ripples go out, you can imagine that's how a pandemic spreads. It doesn't hit everywhere all at once. This is a map of the United States, all of the cases that we've seen, and now I'm going to superimpose on that the cases just in the last 2 weeks. And you can see that there are clusters appearing in different places, and that's where the epidemic is spreading at this point. There's a great deal more information on our college website, but I think the way to think about it is that the pandemic in some parts of the United States has reached probably what we would call a mature pattern. Other parts, it seems to be evolving. In another video, I'll show you where Tennessee and Virginia are specifically. There's a great deal more information on our college website. If you go to this icon and click on it, it'll take you to other videos. If you have folks who'd like to be added to this mailing list so they get weekly updates, please contact Ms. Stork at this email address. And as always, if you have any questions or any particular topics you'd like us to address, please let me know. I look forward to hearing from you. Thank you very much.